M-Truck Solutions, your trusted provider for bulk SMSs. We also offer API integrations for all your
challenges facing the world today. Our food production systems and consumption patterns, including how we feed our babies, are significant contributors to climate change and environmental degradation. We can all do something to reduce our carbon and ecological footprints, starting with how we feed our babies. Breastfeeding is the most environmentally friendly way to feed an infant. It produces zero garbage, zero greenhouse gases, and zero water footprint. As we take part in this global campaign to raise awareness and galvanize action on protecting, supporting, and promoting breastfeeding, I want to emphasize that breastfeeding is one of the best investments for saving infants' lives and improving the health, social, and economic development of individuals. Breast milk is a natural, renewable food that is environmentally safe, produced and delivered to the consumer without pollution, packaging, or waste. However, nursing mothers require a conducive environment for successful breastfeeding. You and I have a responsibility for creating such an environment, including during emergency situations such as the COVID-19 pandemic. As most of you may be aware, newborn babies are supposed to be exclusively breastfed for the first 6 months. This means they are not supposed to be fed on anything else apart from breast milk. However, some, if not most, of the new mothers tend to disregard this good practice, which is a key recommendation by the World Health Organization and UNICEF for optimal infant and young child feeding practices. By so doing, one is also denying her infant from being properly formed into a healthy child because of the nutrients that can only be found in breast milk. Currently, according to statistics, only 3 out of 5 children in Kenya are exclusively breastfed in the first 6 months, which means that most infants in the community are deprived of major nutritional, immunological, and psychological benefits which breastfeeding confers. There is no reason why 39% of babies should be denied God-given nutrition of breast milk during the critical formative period of their lives. The other key infant and young child feeding practices include early initiation of breastfeeding within 1 hour of birth. This is then continued up to 2 years of age or beyond, with the introduction of nutritionally adequate and safe complementary foods at 6 months. The Ministry of Health is committed to greater awareness, raising and supporting of breastfeeding through implementing policy guidelines on maternal, infant, and young child nutrition. These guidelines outline strategies for strengthening capacity of healthcare providers, communities, and stakeholders. Additionally, Kenya enacted the Breast Milk Substitute Act of 2012 in line with the International Code of Marketing of Breast Milk Substitutes, providing for appropriate marketing and distribution of breast milk substitutes and promotion of breastfeeding. At the community level, the Ministry is rolling out baby-friendly community initiative to empower communities to promote, protect, and support breastfeeding and address the barriers and negative breastfeeding perceptions that prevail among our elitist young mothers. Our common aim, therefore, should be to re-establish breastfeeding in the country as the cultural norm, thereby making it the natural choice for the vast majority of Kenyan mothers. During this pandemic, minimizing risk of SARS-CoV infection in all groups is important. We must say something as we talk about breastfeeding. We must also link it up with the current time and the pandemic that we're going through. Transmission of SARS-CoV to newborns is thought to occur primarily through respiratory droplets during the postnatal period when they are exposed to infected mothers or other caregivers. Although available information is very scanty, it is very highly unlikely that prenatal vertical transmission of this virus occurs during the intrauterine, intrapartum or peripartum birthing process, as so happens with HIV/AIDS. So it's different. Transmission of this virus via breast milk is also very highly unlikely. Generally, the coronavirus infections in neonates are uncommon. But if neonates do become infected postnatally, the majority tend to be either asymptomatic or with mild disease, and they recover rapidly. Severe COVID-19 illness in newborns appears to be rare, although newborns with underlying medical conditions and preterm infants may be at a higher risk of severe illness. Healthcare givers must counsel mothers with suspected or confirmed COVID-19 on all the precautions to be taken in avoiding transmitting the virus to their infants. The mother should be instructed to wash her hands using soap and water before touching the infant. If soap and water are not available, use of a hand sanitizer with at least 70% alcohol is recommended. Mothers should wear a face mask or a cloth face covering while breastfeeding. If milk, either by hand expression or with a breast pump, as instructed above, before touching any pump or bottle parts. So to mothers, if you are breastfeeding and have symptoms or COVID-19 case, the following steps to avoid the before touching your baby: mask or cloth face covering while breastfeeding. Wash your hands before hand or pump expression milk and before touching pump or bottle parts. It's the best source of nutrition for most infants. During this current COVID-19, in order to and prevent infections and illnesses among children. I urge all of us to support mothers to continue breastfeeding their babies. This is in line with the guidance on infant and young child feeding in the context of COVID-19, in adherence to infection prevention and control measures. Research has shown that the benefits of breastfeeding substantially outweigh the potential risks for COVID-19 transmission. Fellow Kenyans, as we come to end in marking the breastfeeding, appeal to all of you the issue of breastfeeding, which all of us are beneficiaries, so that we can not only have a healthy society, but even a more healthy planet. I would like to take this opportunity to appreciate our development partners, civil society organizations, the private sector, who have continued to support the ministry's efforts in improving maternal, infant, and young child nutrition. One of the biggest partners is UNICEF, and today I am joined Dr. Johan from UNICEF. Before I get into the statistics on COVID, so that we can nicely wrap up the breastfeeding week, I would want to ask Dr. Johan to come and make a few remarks, and then we shall go to the statistics and take some questions from you.
Cabinet Administrative Secretary of Health, Dr. Rashid Aman, Madam Amina Abdallah, Country Director of Concern Worldwide, Madam Jemima Kamad, the Deputy Country Director of Action Contre le Faim, Dr. Simon Kibias, who is the Acting Director of the Directorate of Standards of the Ministry of Health, members and friends of the media, distinguished guests, ladies and gentlemen, I am delighted to join you here today on the occasion of the celebration of the World Breastfeeding Week. When a newborn is breastfed, a very special bond is formed that lasts a lifetime. Breast milk provides a perfect mix of vitamins, protein and fat, everything that a baby actually needs in order to grow. And also, it is important to note that a mother's breast milk also contains antibodies that help fight off viruses, bacteria, and other infections. Ladies and gentlemen, UNICEF and the World Health Organization recommend mothers start breastfeeding within the first hour of life, within the first hour after the babies have been born, and breastfeed exclusively for the first 6 months after the babies have been born, meaning that for the first 6 months of their lives, babies should be fed only with breast milk. We also recommend strongly that women breastfeed their children for food. We generally discourage the use of breast milk substitutes because of the following reasons. It's not that formula is only harder for babies to digest, but very often the water which is being used to prepare the formula may be contaminated and may cause diseases and illnesses. We all know and strongly recommend again that infants who are less than 6 months of age, they need only breast milk, which is the best thing for them in terms of nutrition, for their good health, growth and development. As mentioned by the Cabinet Administrative Secretary, we must make special reference to the spirit of COVID-19 and to strongly mention that even during this period of time, safety of breastfeeding is extremely important. it is normal to ask questions, and that's the reason that we are here, and that's the reason that the ministry is here and health professionals are here, in order to clarify all these questions. UNICEF and the World Health Organization recommend that all breastfeeding women who are diagnosed with COVID-19 should continue breastfeeding in a safe manner. And a safe manner includes very basic measures. The women need to wash their hands before and after touching the baby. They need to use a mask, practicing respiratory hygiene, and the mask needs to be worn also while feeding the baby, and they need to routinely clean and disinfect very frequently all the surfaces in the household. That is a safe manner to continue practicing breastfeeding during COVID-19 outbreak, which is very important. Ladies and gentlemen, according to UNICEF and WHO, increasing breastfeeding to universal level or nearly universal level of around 100% could save more than 800,000 lives of baby every year across the world, the majority being children during the first months of life and during the 6 months of life. It's important to note, ladies and gentlemen, that nearly half of all the diarrheal cases, babies with diarrhea, and another significant part of babies who have ear infections and respiratory infections, these cases could be prevented with increased rates of breastfeeding. With this evidence, we strongly believe that it is clear that supporting breastfeeding is indeed very crucial for the survival and optimal development of babies and children everywhere in the world, and specifically here in Kenya. In Kenya, the good news is that many mothers already understand the importance of breastfeeding. According to recent data of the Ministry of Health, 2 in every 3 children younger than 6 months are being breastfed exclusively, which is very good, but still we can do and should do much better than that. Some of the challenges mothers here in Kenya are facing, as we know, is still lack of knowledge about breastfeeding, and that's the reason that it's important, our friends from the media, that you help us pass this message. There's also problems with the breastfeeding itself and with inadequate support for the mothers to breastfeed. There's an issue that some mothers are facing in terms of returning to work too soon and lack of support from workplaces. And then there is also an issue regarding misconception regarding formulas. And we also know that unfortunately some healthcare providers are still promoting formula. On the last point, I think it is important that in Kenya we do more to protect the healthcare workers from the influence of the baby food industry through stronger enforcement of the Breast Milk Substitute Act from 2012. Ladies and gentlemen, I would like to close soon, but before closing I would like please to mention and to reiterate the strong solidarity of UNICEF with Kenya in its fight against COVID-19, and I would like also hereby to commend the government of Kenya and especially the Ministry of Health for the very swift and very decisive action to contain and mitigate the COVID-19 outbreak and the secondary effects on the health system. UNICEF has been tirelessly supporting the government of Kenya and the Ministry of Health in their efforts to respond to the COVID-19 outbreak through provision and procurement of medical supplies, improving access to hand-washing facilities and supplies, and also working on public health communication. In addition, we are very much engaged in supporting the ministry and the counties to maintain essential health services and nutrition services during the COVID-19 outbreak. It is critical that children, women, and communities here in Kenya are able to go and get quality health services such as antenatal care, safe delivery, immunization, treatment of acute malnutrition, and other common childhood illnesses. Children and families also need sustained support for preventive health practices. Kenya is progressing very well overall in child health and nutrition, and we would not wish to see that progress be unraveled due to the COVID-19 outbreak. In conclusion, UNICEF, as a member of the United Nations country team here in Kenya, will continue to support the Ministry of Health and the government of Kenya as a whole, as a government and ministry lead the efforts to contain and mitigate the COVID-19 outbreak and protect the essential health services provision to children and women in Kenya, including the protection, promotion, and support to breastfeeding. Ladies and gentlemen, thank you very much. Asanteni sana. God bless.
Thank you, Dr. Aaron, and thank you, UNICEF, for your continued support to the Ministry of Health and the Government of Kenya. And I'm sure that we will continue to count on your support. Before we get off this subject, I want to bring to your attention that we have a booth at that end that has much more information on breastfeeding and the breastfeeding week that we are commemorating. Please, you are welcome to go and take a look at the information there after we have finished our session. Let me now move to the statistics, COVID-19 statistics of the day. Today, we have 538 people who have tested positive after testing 6,195 samples over the past 24 hours. This brings our caseload of COVID positive persons to 24,411. And our cumulative tests that we have conducted so far to 335,318. From these 538 cases, 516 are Kenyans and 22 are foreigners. 333 are males, 205 are females. The oldest is 85, the youngest is a 2-year-old baby. Nairobi continues to lead in the distribution of cases by counties, recording 277 cases, followed by Kiambu with 72. Others are Kajiado with 55, Nakuru 25, Nyeri 20, Muranga 15, Machakos 9, Busia 8, Mombasa and Migori 7 each, Mandera, Laikipia and Bomet 6 each, Meru, Narok, Kisii, Trans Nzoia 3 cases each, Tharaka Nithi, Wasishu and Makueni 2 cases each, Wajir, Samburu, Kwale, Kisumu, Kericho and Baringo 1 case each. Breakdown of the cases in Nairobi according to sub-counties. The 277 cases are from Westlands 32, Kasarani 23, Dagoretti North 21, Ruaraka 21, Embakasi South 19, Roysambo 18, Kibra 16, Langata 16, Embakasi East 15, Kamkunji 15, Embakasi North 14, Dagoretti South 13, Embakasi West 13, Starehe 13, Makadara 11, Madare 9, and Embakasi Central 8. The 72 cases from Kiambu are from Thika 23, Juja 8, Kiamba 8, Ruiru 8, Kabete 6, Limuru 6, Githunguri 5, Kiambu Town 4, Kikuyu 2, Gatundu South 1, and Lari 1. Kajiado's 55 cases are from Loitoktok 34, Kajiado North 20, and Kajiado East 1. The 25 cases from Nakuru are from Naivasha 17, Nakuru West 5, and Nakuru East 3. 20 cases from Nyeri are from Madira East 8, Kieni West 6, Kieni East 2, Nyeri Central 2, and Tetu 2. The rest of the breakdown is in the document that you will be given once we have completed this brief. I am delighted to inform you that at the same time, 514 patients have been released after recovery from the disease. 431 of these recoveries are from the home-based care program, and 83 have been discharged from various hospitals, bringing the total number of recoveries to 10,444. Again, I want to commend our healthcare workers for this great achievement. At the same time, we are saddened to note that we have lost 8 patients to the disease, bringing our fatality to 399. Of these 8 patients, 6 of them had underlying conditions. Only 2 did not have any underlying condition. We want to send our sincere condolences to the families and friends of all Kenyans who, during this pandemic, have lost their loved ones. Thank you.
Elfas Lagat from Citizen TV, and there's a new study from KEMRI, from samples collected countrywide, that estimates that Kenyans who may have come in contact with COVID-19 is 1.6 million. A while back, the same KEMRI had estimated that 2.7 million Kenyans had come into contact with COVID-19. What is the main reason to this discrepancy of about 1.1 million, and what does perhaps this data reveal? My other question is just seeking clarity on whether the procurement protocols were observed in awarding tenders to those who supplied PPEs to KEMSA, and whether the tendering committee of KEMSA actually complied with Executive Order number 2 of 2018 that requires them to assess the market prices, the technical and financial capacity of the winning bidder, and whether really this means, what actually does this mean in terms of whether these regulations and these terms were complied with. Thank you.
My name is Mwangi Maina from TV47. I have 2 questions. One, the number of foreigners who have tested positive, if we have anybody who came to the country since the country was reopened who have tested positive. And number 2 is that the tendering question, whether there was a pre-tendering or what criteria is the ministry following in awarding tenders through KEMSA. Thank you.
My name is Graham Kajilo from The Standard. My question is on the issues of deaths. From one of the breakdowns that the ministry has, over 50% of patients who die have underlying conditions. We have about 20 who do not have any underlying condition. Like today we mentioned 2 who do not have any underlying condition, but we have another portion of patients whose data is not clearly known. So I would like to understand what did this patient die from? Did they die from COVID, or how comes you don't have any information on what could be their cause of death?
Okay, thank you. Alphas Lagat, you refer to the study on seroprevalence that has just come out. I happen to be an author on that publication. Earlier on, the information that we had provided when we said that there were about 2.7, by extrapolation, 2.7 million Kenyans who have been exposed to the virus, was based on a limited number of samples. Remember, this study looked at blood donors, samples from blood banks, and the number of samples that were available at the earlier time were fewer than the ones now that this study has published this work with. We went on to expand that sample because sampling is very important in research and science, in order to be able to use that sample as a representative sample of the population and make those necessary extrapolations. Still recognizing that blood donors may not perfectly represent our population. I think it is still a fairly good way of looking at the level of exposure of the virus in our community. So that is why it has come down now, because more samples have been looked at in the various regions that we're looking at. And if we look at this Nairobi metropolitan area, which is really the hardest hit, I think the study revealed that at least up to 5.2% of the population is exposed has been exposed to the disease based on the fact that antibodies to the virus were detected in their blood. So, as you increase your sample number, basically you will get more and more closer to the true level of prevalence, and that is why you see that refinement in terms of the numbers. There are two questions that touch on issues to do with procurement of health products and commodities by KEMSA. As you know, KEMSA is it's a SAGA, semi-autonomous government body that has it carries out its mandate of procurement following the laid down laws that govern procurement. And remember that even though we have the Procurement Act, that there are also provisions under circumstances such as the ones that we are going through now, which is a pandemic and an emergency, that there are certain flexibilities that particular law also allows. I would not want to get into what was done right and what was probably not done right, but I'm sure that we have the relevant oversight authorities that will be looking into that process, whether the process was conducted according to the law, even given the provisions that it is an emergency time. But I think that we shall leave to those agencies to determine. Maina Mwangi Maina, TV 47, I think your question was also related to the tendering, which I have responded to. Kajilwa, yours was largely on the debts and ascribing underlying conditions to these debts. More than 50% indeed do have underlying conditions that are known, whether it is diabetes, hypertension, cancer, or some form of other non-communicable disease, or maybe even a communicable disease. That is what is meant by those underlying conditions. This percentage that you say is missing, the reason that we do not have sufficient information of that is because there is also missing information regarding the condition of these particular patients. It is not very clear from the information that is collected in the various facilities where these patients are taken care of, that sometimes we do not have the complete information arriving here in good time so that we can make that assessment. So often we may have to go back if the information is not complete, that is coming back here to the ministry to determine really what was the condition of some of these patients upon death. But one thing I can tell you is that when we stand up here and say we have so many deaths due to COVID-19, that is actually a confirmed death based on a test to determine that the virus was detected in those individuals, either before death or in some cases posthumously. Okay. So I think that takes care of the questions that were posed. I want to thank you very much. Oh, yes, yes. I can say that I don't think in this number we said 22 foreigners today, isn't it? I don't think any of them, and I had explained this earlier, the foreigners, when we talk about them in the context of the tests we carried out, these are residents within the country. Dr. Yaron here, I think he's a Kenyan, but he could be a foreigner who's residing with us and works with us here. And, you know, if he went to a facility and was determined positive, the fact that he may not hold a Kenyan passport qualifies him as a foreigner, but he's still a resident of the country. So most of those that we report here are residents in the country. We are unlikely to pick any positive coming in with the opening up of the airspaces because of the stringent protocols that have been put in place for arriving passengers, one of which is the COVID-19 free certificate and the process of screening that takes place. So this time around, as we have opened the airspace, we're definitely much more prepared in screening and determining who is able to enter this country, which is the reason why you see the list of countries from which passengers can arrive at JKIA keeps changing based on the risk level of those countries. So I don't think that we have seen any yet following the opening up of the international airspace. Thank you. So you're welcome. You can take some shots there of that booth. We have a team here to respond to any of your questions on the subject of breastfeeding and the celebrations of the Breastfeeding Week. Thank you very much.